The following segment is sponsored by Intermountain Healthcare. Today is our monthly KUTV Ask the Expert, and with Valentine's Day tomorrow, we're talking all things heart health.
This is Dr. John Mitchell, and he's a cardiothoracic surgeon at Intermountain's Utah Valley Hospital. Thanks so much for joining us, Dr. Mitchell.
Thank you very much, Brooke. It's a pleasure to be here.
Okay, so we all have a heart, but men and women, are we going to feel symptoms differently if we have a heart attack?
That's a great question, and the difference between men and women really is dramatic. Men typically kind of have the Hollywood heart attack that you see in the movies, the crushing chest pain, fall over, and unfortunately, often those men die. Women, about 50% of women can have those same symptoms, but women also have other symptoms that most people are not aware of. Severe fatigue, neck pain, arm pain, nausea, mental status changes, vomiting. Those can all be signs of heart disease in women.
Wild, because I would think if I'm tired and if I have neck pain, I'm just thinking that I've been pushing it a little bit too much. I would never think that I'm having a heart issue.
Yeah.
That's correct. So other things go along with that. Age is an important factor for sure. Family history, as we were discussing a bit ago, but also diabetes, tobacco use. Women and men, we need to know our cholesterol numbers. If we have some extra weight that we're carrying around, that's a risk factor as well. And certainly tobacco use and diabetes mellitus are big risk factors.
Now, I didn't know that heart disease is the #1 killer in women.
It is the #1 killer in women. It is not cancer.
That's what I thought was cancer of some kind.
So about 24% of all deaths in women is secondary to heart disease. And that is by far the leading cause of death in women, as it is in men.
What can we do to prevent this? Is there anything we can be doing now?
Absolutely. So we all need to keep track of our weight. We all need to try and be on at least a 35-minute exercise program a day. If we're diabetics, we need to be monitoring our sugars and keeping our sugars in good control. We should all know, starting at about the age of 40, 45, we should all know what our cholesterol numbers are and direct attention to keeping our cholesterol in check.
Okay.
And if we smoke, we need to stop smoking.
Just right now, just do it. Okay, and you brought this little chart. Tell us about this.
So this is what atherosclerosis looks like. We start out with a vessel that's clean, does not have all the fat, cholesterol, the calcified plaque that occurs. And then over time, that plaque builds up to a point.
This doesn't look good here.
No.
That's right. The plaque builds up to a point where, in this little model, if we take this and just flip it over, we can see that blood flows through a congested vessel and it becomes plugged, and that's what initiates a heart attack, is when blood flow is lost through the vessel. Then we bring the patient potentially to the operating room or to the cath lab, depending on the extent of disease. And sometimes we need to fashion bypasses onto the heart, where we take a piece of vein from the leg or an artery from the arm, and we use those conduits to form bypasses around the blocked arteries of the heart.
Okay, such important information. Yes, and you can ask the experts at any of your heart health questions today for free. Just call us. We're here all day long, 877-908-0680.
Perfect. Thank you so much, Dr. Mitchell.
Thank you for your time. Appreciate it.